this question, like a nurse reinforce teaching a client on prescribed dabigatran for chronic arterial fibrillation. So dabigatran can treat and prevent the blood clot, and they reduce the risk of stroke. This is the thrombin inhibitor. They work like anticoagulant, antiplatelet. For NCLEX board exam, every student must know each and everything about anticoagulant, about antiplatelet, and thrombin inhibitor. So dabigatran particularly used for chronic arterial fibrillation. So chronic arterial fibrillation, usually patient complain with irregular heartbeat, irregular, often very rapid palpitation because of poor blood supply. So which statement by the client indicate need further teaching? So patient telling something what is wrong as a LPN or RN, I need to correct it. This is the examiner want to know. So there are four options. Which one is wrong? I need to re-educate. So this out of four, which one is wrong? Basically, this is the answer. So I will call my heart care healthcare provider if I do notice the red urine or blood in my stool. So I said the dabigatran is a thrombin inhibitor like anticoagulant or antiplatelet. It is very natural. If patients say any kind of bleeding disorder, they could inform the healthcare provider. As a RN or LPN, when our patient supposed to take anticoagulant, antiplatelet, or thrombin inhibitor, you can tell them if during the medication, if they say they can see any sign of bleeding, always inform healthcare provider, right? So I said not only this one, we could tell them. So when they took this medication, it is good to take with some precursor and routinely monitoring the prothrombin time or INR, or patient should avoid the over-the-counter medication or herbal product, right? So second, so number one is not an answer. If I said monitor the sign of bleeding, hematuria is the one kind sign of bleeding as well. So I will not stop the taking dabigatran even if I get a stomachache. Number two makes sense. If I have a stomach pain, stomachache, I could stop this medication. But exception is dabigatran. Dabigatran, I said, we use for prevent and treat the blood clot and reduce the risk of stroke. But if you stop suddenly, it is increase the risk of stroke. You can stop after the talking to the healthcare provider. So we will not take a decision about it. So we will not stop. We learn this information from here. And number four, I will swallow the capsule. You see, swallow the capsule. We are not allowed to crushed out or break down the capsule. If you crushed out the capsule, absorption will be increased and increase the chance of bleeding. And definitely, if you take with full glass of water, it is good for the patient. So number 4 is not wrong. Number 3, I will place the capsule in my pill box so I will not forget to take a dose. I said this is the question we are discussing, but actually we are going to learn some new information what we do not know. So I will place the capsule in a pill box. It is not right because dabigatran we can open up just before use. When you keep in the pill box, medication chance to come with moisture and chance to come contaminated. So this is a wrong. Let me read the explanation what they said. Thrombin inhibitor such as dabigatran reduce the risk for clot formation and stroke in the client with a chronic atrial fibrillation. The nurse should educate the client about implementing the bleeding precursor. So we have to prevent the bleeding tendency using a soft brushes during the cleaning the teeth or using the electrical razor for shaving. Dabigatran capsule should be kept in an original container or blister bag until the time to use. Why? To prevent the moisture contamination. And what are the educational objectives? So thrombin inhibitors such as dabigatran reduce the risks for clot and stroke in the client with chronic atrial fibrillation. The nurse should teach the client to use the bleeding precursor or monitor for symptoms of bleeding or swallow capsule with a full glass of water. So swallowing the capsule, what is okay? We do not allow to crushed out, right? And also we have to keep the medication in the original container. So this question, a client has just been prescribed allopurinol for chronic gout. So the key point here, the patient is diagnosed by the gout and treatment of the gout use the allopurinol, right? Which instruction is the most important for the nurse to emphasize to the client? So there are 4 options. Which one is the most important for the patient who have gout and treated by allopurinol? You have to focus and trace it out, explain more. You could educate about it, right? So gout, so there are 2 types of gout, acute or chronic, or sometimes we call gouty arthritis. Okay, so gouty arthritis or gout, usually the patient who have gout, the uric acid level go up and uric acid is deposit in the joint and they develop the crystal and patient feel the pain. Okay, The other sign symptom, the patient who have gout usually present with low-grade fever, swelling in the joint, or renal stone formation. This is the main point every student must know. Okay, the stone formation. So you have educated your patient, decrease the purine in the diet, or every day take enough fluid. Increase the fluid at least 2 liters to 3 liters per day. So allopurinol is one of the drugs we use for the gout. Other most common medication we use is called colchicine or probenecid. But here we are going to focus about the allopurinol. So as I told you, keep this note. Gout patient has a chance to develop the stone formation. So let's go what you need to focus and educate your patient more. Report for periodic laboratory tests for kidney, liver, and blood function. So nothing wrong. Gout patient has a chance to develop the stone formation. So it is good to laboratory test for kidney function, liver function test, or any kind of blood test, complete blood count or other test for dyscremiasis. Or store the medication in a cool, dry place away from direct heat and light. It makes sense. Every medication we have to keep away from direct sunlight for keep the activities of drugs. It is not wrong as well. Take the medication after a meal to prevent gastric distress or indigestion. So it is also common sense. Anti-gout medication, if take after food, it is prevent the gastric indigestion. Number 4, take the medication with a full glass of water and increase the fluid intake per day. So out every point important, but number 4 is super important because gout patient has a chance to develop stone formation in the kidney. So if patient take enough fluid, the small stone expel out through the urine and you can prevent stone formation in urine. It is very important. So when your patient need to take allopurinol for anti-gout, we could educate them about some important information like gout patient can cause kidney stone formation. Tell your patient do not eat organ meat or alkaline diet. So do not eat organ meat, but prefer alkaline diet. So alkaline diet is used with a gout because they increase the pH and reduce the acidity in the urine. And also make sure your patient take enough fluid. Drink at least 8 glasses of water to prevent the kidney stone. What are the other information? And what are the note we could learn from here for NCLEX board? Allopurinol is prescribed to prevent gout because it is the anti-gout medication. What are the other medication we use? Anti-gout, we use colchicine or probenecid, same medication. So prevent the gout, and already I explained gout is a inflammation or pain in the joint, right? Elevated the uric acid. So it inhibits the uric acid production. In allopurinol inhibit uric acid production and improve the solubility. So stone is kept out from the body. Allopurinol should be taken with a full glass of water, and it is very important for nurse to educate the client about fluid intake with this medication. The client should also increase daily fluid intake, as this will help to prevent formation of renal stone and promote diuresis. So if a small stone formation, they can kick out through the urine. There does not chance to accumulate and make a big stone. So make sure your patient take at least 8 glasses of water per day to prevent kidney stone formation. What said more? It is important the nurse to educate the client taking allopurinol with drinking of full glass of water each day, increase the overall fluid intake, and increase the fluid helps to prevent renal stone and promote diuresis, uric acid excreted. Explain the, let me read the question. The nurse is passing the prescribed medication to the client. Which schedule administration should the nurse hold and need to clarification from the healthcare provider? Means what is wrong? I need to discuss with the healthcare provider, or need to hold, make a decision, is this good or wrong, and then go forward. So select all. So there are 5 options. Which one question arises? Need to clarification first, right? So number 1, the client diagnosed with cirrhosis and has a 2 stool per day or today, laxative lactulose prescribed daily. Number 1, or patient number 1 diagnoses the cirrhosis, means liver problem. When patient has a liver problem, chance to develop accumulate ammonia, and ammonia increase the level, enter to the brain, and impairment of brain function or cognitive function impairment. Patient develop confusion. To avoid all of this, we can give them lactulose. This is one indication of lactulose. Other indication, if patient has a constipation, if you give them laxative lactulose, it is nothing bad. 2 times or 3 times stool day per day, nothing serious. It's okay. You do not need to hold the medication, talk to the healthcare provider. Nothing wrong. Number 2, the client is casual for abdominal surgery tomorrow, and vitamin E orally given every day, right? So this is the important note every student must know. The herbal medication started by the letter G, like ginkgo biloba, or the St. John's wort or vitamin E, all is anticoagulant. So all anticoagulant medication like warfarin, heparin, coumadin, you have to hold before surgical operation. You have to hold also the medication, the herbal medication, the chance of develop the bleeding, blood thinner, like vitamin E or other herbal medication called garlic or ginkgo or Steven Johnson. Sorry, um, I said the Saint John's wort, right? Their blood thinner, chance of bleeding before surgical operation. You must hold it. Vitamin E, one of them, is called tocopherol. When you take orally, you could hold it. So patient number 2, we could stop and talk to the doctor or physician for further steps. Either one answer. Question number 3, the client is receiving IV vancomycin infusion. Mild facial flushing noted after 30 minutes. So vancomycin is a very strong antibiotic or antimicrobial we use for serious bacterial infection. As a LPN or RN, every student must know the side effect of vancomycin. Vancomycin can cause ototoxicity or renal toxicity. But this question not about related ototoxicity or renal toxicity. This is different. Another side effect of vancomycin, it is called infusion reaction or phlebitis. Vancomycin, if you give the patient, you have to check or monitor vancomycin blood level. One of which of information. Information number 2, vancomycin you could infusion very slowly. Why? If you rapidly give patient chance to develop the facial flushing or Redman syndrome, but it is not an anaphylactic reaction. It's not a medical emergencies. But you have to told your patient before about this. And as a RN, you have to know how to deal with them. So it is known about the vancomycin, nothing serious. Let me read their explanation. Vancomycin should be infused over at least 60 minutes. Infuse by 2 hours, very slowly. When it is given too fast, the client may develop Redman syndrome. Means cutaneous blood supply increase and patient look like red, and we call Redman syndrome, which is characterized by facial and upper body flushing, blood supply increase behind the skin, cutaneous blood supply increase. And if this occur, the infusion need to be slow or stopped and restart after certain amount of time. And it depends on flushing severity. However, it is not any anaphylactic rash. It is not any allergic reaction, not an emergency. You do not need to inform, but keep the documentation. And I said, vancomycin, don't go for too fast. slowly. So it is your fault, basically. So this client is experiencing only a mild reaction. Therefore, by slowing the infusion rate, the nurse can manage this side effect independently and does not need to contact the healthcare provider. Right? So it is not abnormal, nothing abnormal. The other option, the client with diabetic has insulin glargine and aspart. So there are two insulin combination, glargine and aspart. And morning glucose is 100 milligram per dl or 5.6 millimole per liter. We do not say anything wrong. So before surgical operation, you have to continue the insulin medication, because patient have a diabetic. You have to know how to control the blood sugar before surgical operation. Nothing wrong. Now I said number 5, lisinopril orally is prescribed daily, and serum potassium level is 5.6. So usually the potassium normal range is 3.5 to 5.0 milliequivalent per liter or millimole per liter. So it is little bit high. So patient hyperkalemia. So I said hypokalemia or hyperkalemia, both are bad. We need to stop, we need to adjust, we need to contact with the healthcare provider, because hypokalemia or hyperkalemia lead to metabolic problem and lead to cardiac dysrhythmia and so many complications, even cardiac arrest, right? Because of imbalance of potassium, hyperkalemia. So what is their explanation? So lisinopril is a ACE inhibitor, ACE inhibitor. It is angiotensin converting enzyme inhibitor. Another medication is called ARB. ARB stands for angiotensin receptor blocker, and this is angiotensin converting inhibitor. Basically, ACE inhibitor ending by pril, like lisinopril, captopril, enalapril, and ARB stand ending by sartan. So the drugs that end in sartan, like losartan, valsartan, so ending by SARTAN, they are angiotensin receptor blocker. So create the risk for hyperkalemia. So hyperkalemia is the adverse effect, side effect. So we could monitor the potassium level, right? So increase this, also say, what next? ACE inhibitor decrease the excretion of aldosterone, and orally aldosterone would increase the sodium and decrease the potassium. However, the ACE inhibitor suppress the aldosterone and potassium raise. So here I said the placing the client at the risk for hyperkalemia, especially in the presence of impaired renal function. The nurse should question the administration of ACE inhibitor in the client who is hyperkalemic. So SC inhibitor block the enzyme that converts angiotensin 1 into angiotensin 2. Angiotensin 2 is very powerful vasoconstriction that will increase the blood pressure. And angiotensin 2 also cause the secretion of an additional blood pressure elevating hormone in adrenal gland, and this is called aldosterone. You see, the SC inhibitor suppress the aldosterone. So keep in mind, SC inhibitor have some effect over the blood vessels or heart. What it is? SC inhibitor lower the blood pressure, so we use antihypertensive. The workload of the heart also reduce. The vessel, arteries or vein will dilate it, increase the blood supply, and helps the kidney to excrete the sodium and water. But some contraindication you have to keep in brain when you prescribe or when your patient take the SC inhibitor, what it is. So patient with hyperkalemia, or if the patient develop angioedema, always we have to avoid. And also keep in mind, if patient develop hyperkalemia, avoid the potassium supplement. If your patient are pregnant, they are not a good candidate for SC inhibitor. Or if your patient give the breastfeed, they are not a good candidate. So next, what education objectives? So client receiving SC inhibitor should be monitored for hyperkalemia, especially in the presence of renal insufficiency. Certain herbals like garlic or ginkgo or vitamin E can increase the risks of bleeding, right? So before, if patient go for surgical operation tomorrow, you have to hold it. Not only this, you have to hold anticoagulant, warfarin, heparin, coumadin, right? A scheduled insulin regimen is given to maintain glycemic control, even if the blood glucose level within normal limit, because you have to control the blood sugar. So here we go. The question: the nurse admit 15 unit of aspart insulin. So aspart insulin is a rapid acting insulin. They work within within a minute, within 10 to 15 minutes. So when you give the insulin and insulin start to work, patient starts to develop hypoglycemia. So you have to prepare to prevent hypoglycemia, because hypoglycemia is, both are bad, but hypoglycemia is dangerous than hyperglycemia. Patient chance to develop unconscious. So 15 unit of aspart sub-Q or subcutaneously to the client, right? Who is diagnosed by a type 1 diabetic. Type 2 diabetic patient, we can give oral anti-diabetic medication like I said glipizide or any other drug like glucophage, right? Oral, but type 1 is always treated by insulin. This patient takes 7 a.m. for fasting blood glucose. Oh, when you check the fasting blood glucose at the AM, 7 a.m., you found 180 milligram per DL or 10 millimole per liter. It is high. You need insulin them. But when you give the insulin, you have to prepare to prevent hypoglycemia. So out of 4 options, which is the most important, most priorities? One, ensure that the client continue to fast for at least 30 minutes before 30 minutes before. Ensure that the client continue to fast for, it does not make any sense, right? So it is not necessary basically. Give the client breakfast within 15 minutes because as I told you, SPART or Lispro, they are rapid acting. They start their function or onset of action 10 to 15 minutes. Within 10 to 15 minutes, they start to work and chance to develop the hypoglycemia. To prevent the hypoglycemia, you have to prepare the food to feed them within 15 minutes. So give the breakfast within 15 minutes is the most important or priority for this patient because your patient taking rapid acting insulin. Recheck the blood glucose in 1 hour. You can check it, but it is not the first priorities. And teach the client about the signs and symptoms of hyperglycemia. Definitely, we teach the patient sign and symptoms of hyperglycemia. We educate my patient sign and symptoms of hypoglycemia. We do. But when patient in hospital, it is our responsibilities to prevent the complication, right? So keep in mind, hyperglycemia or diabetic patient, when you give the medication, they can chance to hypoglycemia if too much insulin or too little food, both is bad, right? So it is very important. So now I said food should be ready the first priority. In their explanation, they said the insulin type. The insulin, they categorized the basal long-acting insulin and postprandial short-acting. Postprandial means after food, basically. So one is a regular insulin, other is the rapid acting. So rapid acting insulin example is Lispro or Aspart. The brand name is called Homolog or Novolog. So Lispro or Aspart start to work within a minute. Onset of action is 10 to 15 minutes and they go to the peak level within 1 hour to 2 hours. So, and duration of action usually 3 to 6 hours or 3 to 5 hours. And best option for the post-meal hyperglycemia. So your patient take too much food in a party, then you can give them Lispro or Aspart to control hyperglycemia, right? But it is very important, keep it in mind, rapid acting insulin good not to mix with other insulin. And the rapid acting insulin like Lispo or Aspart used for rapid reduction of glucose level, or we used to treat postprandial hyperglycemia and to prevent the nocturnal hypoglycemia. Nocturnal means at the night time, hypoglycemia. Another one is called regular insulin. Regular insulin we called short acting. The example of regular insulin are Humalog R or Novolin R. The onset, they can start within 30 minutes to 1 hour. And the peak level, they go to the peak during 2 to 5 hours or 2 to 3 hours, some book wrote. What does it mean, peak hours? So in this time, they go to the peak level and therapeutic effect is maximum, or patient chance to develop maximum risk of hypoglycemia. You have to concerned about it when patient in hospital. It is your responsibility, your accountability to manage the patient. Also, we give it if anybody develop diabetic ketoacidosis. Diabetic ketoacidosis is called shortly called DKA. So, or if the problem is type 2 diabetic, we call hyperglycemic hyperosmolar non-ketotic coma, right? So if the patient has absolutely absent or deficiency of insulin, patient chance to develop diabetic ketoacidosis, right? So we use the regular insulin. So another way of classification, division of the insulin is called basal long-acting. Long-acting insulin is NPH, what is called immediate acting insulin. NPH means natural protamine hagadron or humalin N, right? So the advantage of this, we can use twice daily. So good, right? Twice daily. And onset, it is 2 to 4 hours, and they go to the peak level 6 hours to 12 hours. Usually, the indication of NPH or intermediate acting insulin usually taken after food, whereas the regular insulin usually admin before a meal or maybe taken along or to combination with longer acting insulin, right? And now go this one called glargine. So glargine or ultra lenta are long acting insulin or very long acting insulin. The advantage of this insulin, we can use once daily. So one single dose can cover 24 hours. And they start the function or onset is within 1 hour. And if you ask me about the peak level, they do not have any peak level because one dose for 24 hours, continuous process. And glargine used for basal dose, or we can use even for bedtime, during the bedtime. So what are the note every student know about the insulin? Let me read it one more time. So S part or Lispro or Humalog or Novolog is a rapid acting insulin with onset of 10 to 15 minutes. So they can start work within 15 minutes. Onset is the time it takes for insulin to enter the circulation and begin to lower blood glucose. So chance to develop hypoglycemia. The peak effect take 30 minutes to 3 hours and duration of action 3 to 5 hours. It is important for the student to ensure that the client eat within 15 minutes to prevent hypoglycemia, right? So what next? It's called education objectives. It is same thing, just let me recap one more time. It is the important for nurse to ensure that the client eat within 15 minutes of administration of rapid acting insulin such as Aspart or Lispro, right? So to prevent insulin related hypoglycemic reaction.